Hello, I'm Faye Ferrer and I will be discussing Module 2. Module 2 is on international and national healthcare waste management laws, legislative, regulatory, and policy aspects. The learning objectives for this module is first, understand basic environmental concepts. Second is know the guiding principles of waste management. Third is to understand the WHO policy and core principles for achieving safe and sustainable management of healthcare waste. Fourth is to understand the country's obligation under the Basel and Stockholm Conventions as they relate to healthcare waste management. And last, understand the national and local healthcare waste management related laws and regulations. So in terms of basic environmental concept, you have environmental pollution and pollutants. Human well-being and health is closely linked with the health of the surrounding environment. Any degradation in any of the environmental components, air, water, soil, and biosphere, will have adverse effects on the health of individuals and the environment. You also have the interrelationship of environment and health. Human health is dependent on health of the environment. In terms of international principles of waste management, the following international principles are widely recognized as underlying effective waste management of wastes. You have your circular economy concept, you have the precautionary principle, you have your polluter pays principle, extended producer responsibility, you have your duty of care principle, proximity principle, prior informed consent principle. For this slide, we are introducing to you the circular economy, which is based on three principles driven by design. You have eliminate waste and pollution. You have circulate products and materials at their highest value. And you regenerate nature. It is underpinned by a transition to renewable energy and materials. And a circular economy decouples economic activity from the consumption of finite resources. It is a resilient system that is good for business, people, and the environment. The precautionary principle. So in order to protect the environment, the precautionary principle approach shall be widely applied by states according to their capabilities. Where there are threats of serious or irreversible damage, lack of full scientific certainty shall not be used as a reason for postponing cost-effective measures to prevent environmental degradation. Duty of care for wastes stipulates that any person handling or managing hazardous substances or related equipment is ethically responsible for applying the utmost care. Proximity principle recommends that treatment and disposal of hazardous wastes should take place as near as possible to the point of production, as is technically and environmentally possible to minimize risks involved in the transport. The polluter pays principle, all waste producers, including product manufacturers, are legally and financially responsible for safe handling of waste, environmentally sound disposal of waste, and the principle creates an incentive to produce less waste and less toxic waste. Prior informed consent requires that affected communities and other stakeholders be apprised of the hazards and risks involved in the transport of waste and the setting and operation of waste treatment and disposal facilities. The World Health Organization core principles on healthcare waste management: you have to prevent health risks to health workers and public. You have support efforts to reduce disease from noxious emissions, support the Stockholm and Basel Conventions, and to promote practices to reduce exposures to toxic pollutants from incineration. As part of the WHO core principles on healthcare waste management, it says that safe and sustainable management of healthcare waste is a public health imperative and should be a responsibility of all. Improper management of healthcare waste poses a significant risk to patients, healthcare workers, the community, and the environment. You also need right investment of resources and commitment that will result in a substantive reduction of the disease burden and corresponding savings in health expenditure. WHO recommends that all concerned institutions and organizations should promote sound healthcare waste management, develop innovative solutions to reduce the volume and toxicity of the waste they produce and associated with their products, ensure that global health strategies and programs take into account healthcare waste management. The part of the strategies on healthcare waste management, the WHO has prepared short-term, medium-term, and long-term plans in order to make each healthcare facility's healthcare waste management plan successful. One of the short-term plan is to develop recycling options where possible, use PVC, polyvinyl chloride-free materials, promote small-scale, non-incineration alternatives. The medium-term plan is to reduce the number of unnecessary injections to reduce sharps waste and assess the health risks associated with incineration and exposure to healthcare waste. For long-term strategies, you need to scale up the promotion of non-incineration technologies for the disposal of healthcare waste, support the development of national guidance manuals for sound management of healthcare waste, support the development and implementation of national plans, policies, and legislation on healthcare waste, promotion of the principles of environmentally sound management of healthcare waste as set out in Basel Convention, allocate human and financial resources to safely manage healthcare waste in countries. Here we present to you some international agreement and conventions related to healthcare waste. The Stockholm Convention of 2001, the Global Treaty was formed to protect human health and environment from persistent organic pollutants. Parties to the convention are enjoined to reduce or eliminate release of POPs into the environment, including those unintentionally formed and released from waste incinerators and co-incinerators of municipal, hazardous, or medical waste, or of sewage sludge, among other source categories. Governments must require the use of best available technologies and promote best environmental practices for new sources within 4 years of the convention coming into force in any country. So you have the Basel Convention of 1989. It controls transboundary movements of hazardous wastes, including medical and pharmaceutical waste. Hazardous waste exports for most developed countries to the developing world are banned by the convention. Technical guidelines on the environmentally sound management of biomedical and healthcare wastes were formed, and there's a 2003 guidance that prefers steam-based treatment for infectious waste in healthcare facilities. We also have the Minamata Convention on Mercury in 2013. The Global Treaty was signed in 2013 to protect human health and the environment from the adverse effects of mercury. The convention draws attention to a global and ubiquitous metal that, while naturally occurring, has broad uses in everyday objects and is released to the atmosphere, soil, and water from a variety of sources. Controlling the anthropogenic releases of mercury throughout its life cycle has been a key factor in shaping the obligations under the convention. Article 4 calls for the phase-out of the import, export, and manufacture of mercury thermometers and sphygmomanometers used in healthcare by 2020, and the phasing down of dental amalgam. You also have the Sustainable Development Goals, improved by safe healthcare waste management. There's also a publication from the World Health Organization, Global Analysis of Healthcare Waste in the Context of COVID-19, Status, Impacts, and Recommendation in Basis that estimates on the approximately 87,000 tons of PPEs that was procured between March 2020 and November 21 and shipped to support countries' urgent COVID-19 response needs through a joint UN emergency initiative. Most of this equipment is expected to have ended up as wastes. We also have other publications from WHO, the UNICEF, and Healthcare Without Harm, and the World Bank. You have wash in healthcare facilities, and you have climate smart healthcare. There are also other publications on healthcare waste management that are available for download. So just to be clear, there are conventions and they are formed at the global level. These are guidelines, international guidelines for safe management of healthcare waste. You also have the national level, which are country specific, and they also have they work on national guidelines and regulation. And you also have the local level, wherein facility healthcare waste management plan are developed unique to each facility, and base available practices are enjoined in terms of developing local level plans on healthcare waste management. There are also other national and local laws. You have the RA 6969, or the Toxics and Substances and Hazardous and Nuclear Waste Act of 1990. Particularly for RA 6969, it requires the registration of waste generators, transporters, and operators of toxic and hazardous waste treatment facility. You also have DAO 2013-22, or the Revised Procedures and Standards for the Management of Hazardous Wastes. And then you have the Joint DNR-DOH-AO, which stipulates the policies and guidelines on effective and proper handling, collection, transport, treatment, and storage and disposal of healthcare wastes. And you also have DOH-AO 20821, which is the gradual phase out of mercury in all Philippine healthcare facilities and institutions. You also have RA 9003, or the Ecological Solid Waste Management Act. It ensures utilization and environmentally sound methods for treating, handling, and disposing of solid wastes, and encourages waste minimization and segregation at the point of generation. Other national and local laws, you have RA 8749, or the Philippine Clean Air Act of 1999, which promotes the use of state-of-the-art, environmentally sound, and safe and thermal non-burn technologies for the handling, treatment, destruction, utilization, and disposal of sorted biomedical and hazardous wastes. It prohibits incineration, defined as the burning of municipal, biomedical, and hazardous wastes, which process emits toxic and poisonous fumes. You also have the RA 4226, or the Hospital Licensure Act. It requires hospitals and other healthcare facilities to submit waste management plan. You have a very old PD, Presidential Decree 856, or the Code of Sanitation of the Philippines. And you have PD 1586, or the Environmental Impact Statement. Recently, the Department of Health has released the COVID-19 Waste Management Sourcebook. This was released in partner with the released 4th edition manual of healthcare waste management. The COVID-19 Waste Management Sourcebook, released in August 2021, is an additional guideline on managing infectious wastes. It has been developed to supplement the existing waste manual. It incorporates the Philippine policy issuances and guidelines developed in response to COVID-19, as well as relevant international standards. Other sources of COVID-19 waste, such as temporary treatment and monitoring facilities, and COVID-19 vaccination sites in health facilities. As reference to of other non-healthcare facility entities, such as the laboratories involved in COVID-19 testing, DNR-accredited waste transporters and treatment, storage, and disposal facilities, workplaces, and COVID-19 vaccination sites outside of healthcare facilities. A section is also dedicated to discuss management of infectious wastes generated in the household level, such as brought about using face masks in view of the minimum public health standards in the new normal and the home quarantine treatment of some patients. In summary, waste treatment aims to eliminate the hazard and/or exposure. The Stockholm Convention and other international legislation calls for reduction, elimination of incineration to reduce unintentional persistent organic pollutants. And there are various international publications on healthcare waste and plastic waste management that can be referenced when healthcare facilities work on their waste management plan. That's it for Module 2. Thank you.